My name is Dr. Dion Middlebrooks, and I'm going to show you how to perform a self-assessment for diastasis recti. It is important to note that following pregnancy, this can be a normal occurrence. It is also important that you realize that every woman is going to heal at a different rate. Depending on the location of your diastasis recti, that will determine the type of exercises that may be best for you. So let's go ahead and jump into this self-assessment. So let's begin with the self-assessment for diastasis recti. First, I want you to locate the linea alba. That is the band that runs in between the abdominal muscles on each side. It typically runs directly down the center of your stomach in line with your belly button and also that sternum or that chest bone. With that linea alba, you want to make sure that is actually pushing up into your fingers as you're assessing this. If not, that could be an indication that you have diastasis recti. You also want for the abdominal muscles to close in around your fingers. A width of 2 fingers or less is considered to be normal. Like I said earlier, after pregnancy, it is not uncommon for women to have a width that is greater than this. It is also not uncommon for individuals to have a slightly deeper depth as well. So in order to assess, first I want you to locate the belly button because we're going to check just above the belly button region. You can begin with 3 fingers because, as we said, 2 fingers or less is considered normal. With 3 fingers, you're going to just gently let the fingers sink in at that linea alba. Once the fingers sink in, you're just going to gently lift the head and the shoulders off of the mat or table in which you're laying. With that, what you should feel is you should feel that linea alba push up into your fingertips. You also should feel those muscles close around those fingertips. If you're not feeling that, you could have a diastasis recti. In order to assess the actual width of it, you may need to add in additional fingers. Depending on how many fingers you add in, that will determine the width of your diastasis. Also, you want to take consideration as to how deep it is. Do you just get the tip of the nail itself, or are you actually getting up to the first knuckle? Some individuals may notice they're getting much deeper than that, and that's okay. This is simply your starting place. With those same measurements, you want to actually check up closer towards the sternum bone, so finding the base of the ribs and moving in, assessing there. The one that we just did above the belly button, and also moving just below the belly button. You don't want to check too far down towards the pubic bone, so make sure that you're just below that belly button region. Same thing, lifting the head up, you should feel the muscles enclosing around the finger and also that linea alba pushing the fingers up.